like I said, a very special session we have. Thank you so much for our 5 patient partners and our caregiver who've joined us today on stage and for the weekend. I'm going to ask you each first to introduce yourself and maybe tell us a little about your own experience with kidney and/or heart disease. So we'll start over here. Thank you.
Is this on?
Yes.
Hello, my name's Ked Weekey. I'd like to first say that I've had a great life. I've been able to raise 2 kids. I've had a great career. You know, everything has really been wonderful. However, it hasn't always been that easy. I was first diagnosed with kidney failure when I was living in Australia in 1995. I moved back to Vancouver and joined the St. Paul's Kidney Clinic and had my first transplant in 2001 where I got a kidney from my mom. And that was really good and life was good. Then I woke up in 2006 not feeling right. And after about 5 weeks of hardship, I was diagnosed with heart failure and had open heart failure where they repaired one of the leaves on my aortic valve. Again, I was very good for a while, and then in 2009, on a cardiac checkup, again, they said, well, the valve is failing because they just repaired it, so then they replaced it with a bioprosthetic aortic valve. In 2016, I started getting sores on my hands and my feet, and I had caught something called, what was it called again? Haemophilus, a mycobacterium, and then I had to go on an antibiotic course. It was extremely painful, and it took a long time to figure out. As that was ending, my kidney function was failing again, and in 2018, I started dialysis. 8 months later, I was able to get a transplant from my wife this time, and since then, I have been fairly good, although I have also caught another infection that had to be treated with a course of antibiotics. The one thing that came from earlier I just wanted to mention is that you talked about a UACR test. And I checked, I do get that test. I don't know what it means. I don't know if I should be looking at it. And I think I'm a fairly informed patient, and I looked at things like creatinine, GFR, hemoglobin. But maybe we should be telling our patients that that's a number we should be keeping our eye on and what it actually means. Thank you.
Thank you.
Thank you so much for sharing your story. I appreciate that. I appreciate being on the stage, and thank you for the opportunity from the KDIGO group. I didn't know how to actually pronounce that till I got here today, so that's fantastic. My name is Mark Baines. I'm a person with lived experience of heart failure and a heart transplant recipient, also based in Vancouver. I was diagnosed with heart failure in 2008 at the age of 23. I mean, all of you from around the world are thinking, like, what's in this water? Ken and Mark look so good. How are they doing this? Who knows what it is? Maybe it's our care at St. Paul's, potentially. I lived with heart failure for 10 years, from 2008 to 2018, and I had my ups and downs, as a lot of heart failure patients do. I mean, during the good times, I was able to get back to work. I was able to travel and really had a good quality of life. During the downtimes, there was times where my family and friends thought they had lost me. Ultimately, in 2016 to 2018, where I was going through a series of arrhythmias, led me to be on the heart transplant list, and again had my heart transplant June 6th of 2018. Through that experience, had the opportunity to really be involved in advocacy. Early on in my diagnosis, met fellow patient partners who had guided me through my heart failure. Because when I was first diagnosed, I was, again, 23 years old. I had just graduated university. I had traveled around the world for 6 months. I was entering what I call the adult stage of my life. And then I'm hit with heart failure, an ejection fraction of around 5 to 10%. And I thought this was the end of my life. I thought, am I going to die? That was my first question. The cardiologist said no, but we had a lot of work to do. And then it was only when I met patient partners where I understood that heart failure was not going to define who I was. So that advocacy journey led me to co-found Heart Life in 2016 with Dr. Jillian Code. And through that organization, we're a national organization, we help to educate, engage, and empower people with lived experience. So it's nice to present and be on stage again with all of you. Thank you so much.
Good morning. My name is Manvir, so I'm from Malaysia. In 2001, end of 2001, I worked in sports broadcasting for the biggest cable TV station, and I was suddenly diagnosed with end-stage renal failure. So I had a bad experience from my first nephrologist. The second one was more sane, so really helped me through that. I started dialysis in 2002, and I had my transplant in 2012 when my wife gave me her kidney. One of my kidney doctors is here for my transplant. And what happened is during that period when I was on dialysis, I apparently had a mild heart attack. One of those days when you're doing your dialysis. I didn't know about it. We found out about it years later. And I was diagnosed with heart failure. Now, when the words heart failure come at you, they come at you like a brick wall. You know, it's a sledgehammer to your head. You're trying to process that. So I didn't understand what it meant. But I was thankful that I managed to have a great cardiologist that explained it to me at that point and did challenge me to get back on my feet. Obviously, being on heart failure, just walking from here to the end of the door was a huge chore, but I managed to try to do that and extend, and you know, got better until when I was done a pre-transplant checkup for my heart. The cardiologist told me, listen, you suffer from heart failure, your right ventricle is blocked 100%, but you're not symptomatic of this because you're playing football twice a week. Right, my knees are short, but everything else was fine. So he said, okay, you can go for the transplant. So long story short, I had that transplant. It obviously changed my life. And that is when I suddenly realized, after I had my transplant, I was the first person that I've ever met who has had a transplant. Right, so I started working with the doctors in my hospital, trying to meet other patients. And obviously, heart failure got worse over the period of time. I now have an ICD implanted in me as of last November, right? And my heart function has increased because after they did the ICD, they did an angiogram, checked my heart, and they found there were 2 other blocks because I've got one already for my 100%. So they cleared it for me, and now I'm doing much better. So I constantly know that I am the data that my doctors need, right? So I've got my Garmin on, I've got all my data to tell my doctors this. Now, what was very surprising was, so I'm a transplant patient, right? I was not diabetic before that, right? I'm diabetic now because of my medications. But I'm a transplant patient, I've got heart failure. 2 years ago, I climbed Malaysia's highest mountain, right? It was about 12,000 feet or something like that. It was the hardest thing that I've ever done. Seriously, I wouldn't recommend it again. For myself, right? But you know, it was difficult to do it, but I did it because I had my doctors behind me. You know, I had to give, from the mountain, the guys at the mountain, I had to give them a letter from my doctors saying that it was okay for me to climb, which meant that I had to prove to my doctors I could climb this, which ended up with all my Garmin data being showed to my doctors and saying, listen, this is what I do. I'm cycling, I'm exercising, I'm doing all these things. And they say, okay, so that's what your heart rate peaks at, that's what it comes down, this is your blood pressure. All that data came from me. So it is a partnership of working constantly with your physicians, you know, with your specialists. And I know that I go to 2 different hospitals in Malaysia right now. My heart doctors and then my nephrologist. I have to carry my files across and inform both sets of doctors what the other one is doing for me, right? Because at the end of the day, I think we are the people who want to live that life. I know from a clinical point of view, most doctors look at it and say, okay, I'm giving you this medication, go home with it. But after that 15 minutes of consultation that you just mentioned just now, I have to live that entire day with myself. And which means that having other patients around me that continue to help me on that path has been very, very important. Thank you.
I think so, yes. I'm Carmen Gray, and I am new to dialysis. I just started in October, so this journey is new. And meeting Manveer last night, I told him that I was very inspired by him because I'm pre-transplant, hopefully, if all goes well. I will maybe not live as lofty a life as far as climbing a mountain, but I have 2 beautiful grandchildren that I would like to see grow up and teach them to garden and to cook and all those other things.
Thank you.
Thanks.
Hi, my name is Jaya. My journey is as long as theirs over there. Basically, in 1992, I was 23 years old, and I was diagnosed with Hodgkin's lymphoma, stage 4, and spent a year and a half, almost 2 years, with chemotherapy and radiation. And right around that time, I was diagnosed with diabetes based on steroid-induced diabetes. Then I had my beautiful daughter in 95, and I went into remission, and then I had her in 95, and then in 2000, I had another episode, another lymph node, and it was removed. It was easily removed. And then some chemotherapy and radiation. In the early 2010s, I started having serious endometriosis issues and had to have surgery, had a blockage from that, and from that blockage ended up having a small bowel resection. And from then on, I was just not well. I just was having a hard time breathing, unexplained syncope. I would just be passing out for no reason. And in 2000, I think it was 2016, I woke up. I thought I had the flu. I just was having difficulty breathing. By the time I got to the hospital, and prior to that, I had been in and out the hospital for the heart issues and the syncope, but no one could figure out what was causing it. And in 2016, by the time I got to the hospital, apparently I had suffered 2 heart attacks. And when I woke up, there was a balloon helping my heart pump. And then the next day, I had a triple bypass. And recuperating from that, I was in the hospital for almost 4.5 months. After I discharged, during that time, the 4.5 months that they were trying to get me back to normal is when they noticed that my kidney creatinine number was elevated, but they didn't really focus on it because the main focus was getting me back from my heart disease. And so 2 years go by, and my kidney function now has gone up to stage 5. I am trying to, I'm much like Carmen, pre-transplant, hopefully, and starting dialysis in maybe a month or so, depending on how quickly they can get me to the surgeon. I've been very blessed. I go to UW, and so the doctors have been very supportive, very attentive, which I think makes a world of difference. And I know doctors are so busy, and all of you would like to spend all the time with your patients, but you only have so much time. So I appreciate the time that each of you take with your patients. But having a care team that truly recognizes your different ailments and your different challenges makes a whole lot of difference. And I think that that's what kept me going all these years, because I've been struggling with something or other since 1992. And it's been many times you just want to give up, but most times because I have her, I just had to be resilient and keep fighting. So thank you very much for listening to me.
Hi, my name is Olivia. I'm my mom's caregiver, a recent PA graduate as well. I think from my perspective, I became an advocate for my mom in high school. And it was kind of fueled by my vision to go into the medical field. And one of the things that I wish that more patients had was someone who could advocate for them, because most of the time they don't know how to advocate. And that's why I decided to go into becoming a PA, to be a part of that education, that middle ground, who can have the time to sit and chat and explain what diabetes is, explain what chronic kidney disease is, what heart failure is, because that's really the missing point that I'm noticing is we just don't have the time. So I'm hoping that when I start working in general practice, I'll be able to do that. So.
Well, thank you all so much for sharing your stories. I was looking around at the expressions in the audience and can see that they've really touched all of us. I'd love to invite questions from the floor from anyone. And so please, do think about if there are some questions you'd like to ask and raise your hands. But if not, I'd start with one. And if there's one thing that you'd like us clinicians to know about your lived experience, it's a one message that we need to learn or know. Could you share that with us right now? I was going to say ladies first, but I see Mark smiling, ready.
Thanks, Caroline. One of the things that I've learned over this past 24 years as a patient, past 12 have been as a patient advocate under WHO. So I've been trained. We run an organization in Malaysia. The patient's voice is extremely important. The thing that I've learned that is most important, and we were just discussing it just now, was you guys can't handle this on your own when I mean healthcare. And the reason is there's only 65.1 million healthcare professionals in the world, right? That's according to WHO, right? 65.1 million healthcare professionals, doctors, nurses, specialists, the whole gamut, right? According to WHO, as of January of this year, there's 8.1 billion people in this world. So the math is like 0.7 something percent, taking care of 100%, including yourselves, right? And that math will never work unless you have your patients part of the solution, right? Because I know you were mentioning it just now, and Lisa was as well, you just can't do it. You don't have enough nurses, you don't have enough specialists, you don't have enough of these people, but you have patients. We are on this journey for our lives, for the rest of our lives, right? And so the message that I would say is engage, educate your patients, and empower them to do the things that is going to waste your time, non-clinical stuff. I like Elke's presentation just now when she was talking about that cinema program where there's exercise physicians. You can't do that. You have chefs. You can't do that. But you have within your systems the opportunity to engage with these patients, educate them, and empower them to run that whole part, because we're living with this for the rest of our lives. And in the past 12 years that I've been doing this, I realize that the ministries of health or the National Health Service is wrongly categorized. It is the Ministry of Sick. It is the National Sick Service because they only take care of us. There's no preventative medicine because you guys are behind the ball on this. And it is just because of the simple numbers. It's not about your passion to be wanting to do this. I have met so many physicians, I've met so many doctors around the world that want to do this, but they just don't have the people enough to get this done. Today's technology, which is not done by healthcare, it's done by some IT guy sitting down in I don't know where, but that brilliance helps you. They are merely tools. So one message that I want to share is use the patients as that tool to get across the delivery of healthcare. Thank you.
Sure. All these notes and you only want one message, that's tough. Because I have the mic, maybe I'll say 2, maybe 3, but I mean, Manveer socks are amazing. It's like a little echo on there if anyone can see them. It's fantastic. And I mean, engage, educate, empower. I mean, that's the mission statement for HeartLife, right? And that's key. Yeah, fantastic. So I didn't even pay him to say that. Yeah, I would say, just touching on Olivia's points, in terms of the caregiver, it's so important to incorporate that caregiver voice. Oftentimes they're right by our sides. You talked about heart failure. When I first heard those words, that was all I could think about. I didn't think about my medication. I didn't think about whatever test they were going to do. That was it. And if I didn't have the caregiver there to support me and help me understand what was next, I mean, I would have forgotten all that information. So just, you have to value those caregivers. The second point is, and touching on personalized health care, but understanding your patient and taking a holistic approach to patient care. 2 points. Robert brought up adding life to years or years to life. It's really dependent on where that person is in their journey. When I was 23 years old, I wanted to add years to my life because I had different goals. I had different objectives for what I wanted to do. And that differs from other patients that are in different age populations. So really understanding that patient perspective, their goals and objectives as a person, and then thinking about the find, not find fallacy. So this comes along with understanding your patient. I go into my cardiologist or heart failure specialist office. He says, "Mark, how are you doing?" I said, "You know what, I'm doing fine, doctor. Thank you so much." He says, "Okay, we'll keep you on your current medications. Go on your way." Versus I go into my cardiologist's office or heart failure's office, and he says, "Mark, how are you doing?" "You know what, Mark, doctor, I'm doing fine." He said, "Hey, you're 26 years old. How's your sex life?" People talk about sex and heart failure, so it's okay, people. It's fine. I said, "You know what, doctor? Actually, it's not great because I get short of breath. I'm not confident in myself because I feel like I gained a little weight. I'm a little bloated." But he takes a step back and says, "Well, it's your worsening heart failure." So it's understanding your patient and not falling for that find, not find fallacy. I know you have limited time, but in that limited time, understand your patients, understand who they are, so you can create that care for them in the right way. Thank you.
Brilliant.
Okay, thank you. I guess in part of that participation as a patient, I want to participate in my care. And it's not just about taking the pills on time. It's also about what I put in my body, my nutrition. And it was very difficult transitioning from my diabetic diet to a kidney-friendly diet. And in one pamphlet I got from the hospital as I was leaving, on one page it recommended certain foods. 3 pages later, it said avoid them. So it's very difficult to try and navigate through all of this. And so getting help from you as physicians so we can participate in our care and see you less. So that would be helpful. Thank
you. For me, I agree with, don't know his name, but
Mark.
Okay. Patients like me, for some reason, I tend to think that when my doctor asks me, "How are you doing today?" "Yeah, I'm fine," but I'm really not fine. getting to know your patient, knowing to read the signs. I know it's hard because you have so many things to do, and I do appreciate the physician that can actually look at me and say, "Are you sure you're fine? Because you don't look fine," or something is going on, or that makes a huge difference. That also encourages me to want to do better, be a little bit more honest, because I don't like to worry anybody with my ailments. I tend to just keep it to myself and don't want to be a burden. So even when I see my doctor, I'm like, "Oh, I'm fine." And again, blessed to have doctors who know me personally and know all my complications and have been very generous with their time and very generous with their encouragement and advice. And I think that makes a whole lot of difference. And having an advocate who knows all the history of what's going on with me makes a lot of difference too. Thank you.
Just a note is that the disease, and it's not just this disease, but kidney failure and heart failure affect the family as well. And there's no doubt it really affected my family. I often think that my wife has been more affected by me being sick than she is. And she was a nurse, so she knows too much. When I was diagnosed, she knew what the future was. I kind of like being a little stupid sometimes and not really know what might happen. And it also affected my kids. I think my son once said this is more recently when asked, he felt he was somewhat living in a house of death because, every 5 years there was some other reason I was sick going to the hospital. Although generally, I never felt that. So, some services for the family, and of course every family is different. Some people could take it just like every patient is. Some people could take it, it's just water off a duck's back. Other people, it's all a very, very big issue. So.
Thank you. Meg, you had a question. Thank you.
I'm interested, I think, Olivia, is it, in your perspective? You've obviously looked through both windows. What do you think needs to change in the medical system to make it a better environment for people like your mum to flourish?
I think that's kind of a hard question to answer because each patient has such an intricate life and intricate needs. I know for me, I was a medical student at the time. I was majoring in pre-med, so my days were spent reading journals, and my mom would call me up and say, "This is the new thing that I'm going through," and I'm like, "All right, well, I guess that's what I'm researching this week." So I guess for me at that time, I think I wish I had a little bit more maybe emotional support as a family member, and being as young as I was with a sick mom. I had friends, I was in therapy, all of those things, but kind of having someone in the room to say, "I see you." I had one moment that I remember till this day was my mom was coding, and I was visiting her in the hospital like I usually did during the summer. And all these nurses just come rushing in, and they're pushing me out. I'm terrified. You only see this on Grey's Anatomy, right? And so I just started crying. I was the only one in the room, and one of the nurses took me to the waiting room while they resuscitated my mom, and I just started crying, and he just sat there and let me cry and handed me a box of tissues, and I felt seen, and I think that was the first time that I felt seen. So taking that time to, the caregiver is the eyes and ears, because they're, like has been repeated multiple times, you say heart failure or kidney disease, their mind is like 12 years down the line immediately. For me, I have the ears to be like, okay, they said X, Y, and Z, this is what you need to do. Kind of, even when I got my wisdom teeth pulled, I'm coming out of anesthesia. What makes you think I'm going to remember anything you're telling me right now? So I think just being a part, taking your patient in as a partner. I think as clinicians, we think of okay, I'm up here and you're kind of over here because you don't have the same level of education. You didn't spend as much time reading the books as I did, but they are more in tune with their body than we are. So really partnering with your patients is really helpful. I'll say that.
Just, I think with your question, I have an answer that I think is related. Like we talked about the clinic for the people with heart failure, and my experience more with the kidney clinic was that the kidney clinic is there. You see them all the time, very consistently seeing them, and I had heart failure. I had to see a cardiologist, and they kind of popped in and out of my life. I always say, when I had my heart surgery, my first surgery, I was very weak. And I remember coming out of the hospital, and I think the cardiologist said, okay, check up in 6 months. And as a kidney patient, you aren't used to that. You're used to coming out of surgery and seeing three times a week you see the doctor. And that's a little bit of a shock. And then I also had this infectious disease problem. For the infectious disease doctor, they were part of the clinic. They maybe came once a month or something like that, but there was somebody to call, where I don't quite feel the same way with the cardiologist. And do they actually come to the clinic that they're there once a month so that, anybody could go there? And these other clinics that were talked about seem to be more heart failure. Now we're looking at kidney disease, where I came from the other direction, where I had kidney disease and I had heart failure.
Thank you. I'll ask one last question, if no one else has one. So we've been talking a lot about designing studies and what's meaningful for patients. So my question is, what is good health to you? What would it be, as we think in the future and think about new therapies and designing studies, what are outcomes that are important to you as persons living with these diseases?
That's a really good question. I mean, I think it's really dependent on the patient perspective, but when you think about taking evidence to practice, I mean, you start at the research side of things, right? And when you're thinking about that research and you think about primary and secondary outcomes, a lot of the primary outcomes are hospitalization and mortality. But when are we going to have primary outcomes that are based on quality of life, right? And what does that quality of life then mean? So I think that's part one. So I know that's not answering your question specifically, but then it's also taking the research to the communities that actually are going to benefit. So I mean, a lot of the research in the past, not saying right now, was based on middle-aged to older white men, right? Let's be fair. Nothing against them. They run our countries and our banks and corporations, right? So, but that needs to change, right? You need to take that research where your patient populations are. Brandon said this as well. Get into those communities. Make sure you're doing research on people like me that are 23 years old. How does guideline-directed medical therapy impact Mark when he's 35, right? Do we have that answer? Probably not. So I know I didn't answer your question specifically, but it starts by looking at clinical research and really then taking that evidence into practice with changing those primary outcomes.
Thank you. Others?
I think it's being able to do the things you want to do. And everybody's different. I like to ride my bike and work in my woodwork shop, and I can do that. I'm very happy. Yeah, I can't play hockey now because I have to take warfarin, but I could live with that. And there's a few other things that I can't do, but I can live a great life. But, kind of thinking a bit bigger maybe with this group, at least I thought a little bigger, is, like I look at it like a kidney transplant, or hopefully maybe it's not a transplant, some other way that you have let's say a movable or a portable internal kidney device that works in us. I think that should be a real goal here, because when I read some of the stuff about heart failure and stuff like that, that sounds like a big solution for heart failure as well, if we had that sort of device, so work on that.
One of the discussions from earlier, we were talking about social determinants of health. And they differ from the regions that we are from, right? I just give you the perspective of Asia. This is my first time in North America to be with you guys, right? In Asia, our environment is very different. I have never, in my 24 years, I have never met another person who's done a clinical trial in Asia. I have not done that. Until yesterday, I met Carmen, was having, and I told her, I've never met that, right? So what I'm trying to say is when you guys are doing these guidelines and doing all these clinical research, it happens in a different part of the world, and then we are in a different part of the world over on the other side. And our conversations, our wants, our needs are very different. A lot of your healthcare systems are, I would say, quite mature, right? Ours, I mean, you've got your developed countries, developing countries, you've got your third world countries. The conversations are very different. And as I'm part of a patient network that we've got patients in Africa, in India, in China, in Croatia, and some of them may be in European countries, but again, they're not a mature system. So the conversations that they're having are very different. And we like the fact that y'all are doing great clinical trials and all that, but by the time it reaches us down there, it's like we're having a different conversation there. You know, so I think we should look at really, and I say the word we, because I see myself as part of healthcare. I don't know whether you guys see me as patients, right? So we need to have those conversations where we become that partner, where we are talking about. So you're looking at it from a global perspective, but you can't look at it only from your region. So you have to add in these people. And I think the patients itself, just like you cardiologists and nephrologists, we have our own networks as well. That I'm going to be connecting with these guys to find out what they're doing over here, to try to replicate it over in Asia as well. So that, I think, is important for you when we're thinking about that. Thanks.
Oh my goodness, hallelujah. Thank you for that. Global clinical trials. Well, thank you so much, each and every one of you. This has been a most amazing panel and discussion. Thank you so much.